Hey, how's it going, everybody? I'm here with Dr. Ryan Suen at Pinnacle Wellness, and he's going to tell us a little bit about himself as well.
Awesome. Okay, so my name is Dr. Ryan. I'm the owner of Pinnacle Wellness Center here in Pleasanton. So pretty much a little bit about myself. Before I was a chiropractor, I was actually a personal trainer. And basically, like, I would work with a lot of rehab patients or clients at the time. And, I would run into a curious state where, out of the people that I worked with, the majority of them would respond exactly how you would think it would respond through personal training. You lift heavy weights, you get better at lifting heavy weights.
Right.
But there was a portion of the population that wouldn't get stronger. They were just kind of stagnant and everything like that. And, everybody's care plan, everybody's workout routine, everybody hits plateaus for the most part. So I didn't really think too much of it at the time. But what really puzzled me was there was a small portion of the population that got weaker when they would lift weights, which is like, that doesn't make sense. You pick up heavy things, you get better at picking up heavy things.
Yeah.
It just didn't fit the formula. So I was constantly looking for the answer to that for a very, very long time. And it wasn't until I went to a seminar for personal trainers that focused more on neurology.
Okay.
And the way they kind of explained it was strength, range of motion, speed, coordination, all that kind of stuff is really a nervous system function as opposed to a structural thing. So it doesn't have anything to do with like the size of the muscle or the shape of the muscle or anything like that. It has more to do with how the brain is communicating to the body. And through that, they posed a concept to our class at the time. And they're like, well, you want to think of the nervous system as constantly taking in stimulus and constantly either adapting or avoiding a stimulus depending on where it's at and how it perceives the stimulus to be. So they called it a stress bucket. And they described the stress bucket as this giant bucket with a little spout at the end. And basically all your stressors, all your stimulus goes into the stress bucket. And the idea is that if a stressor is within a normal level where it can adapt to without hurting yourself or requiring too many resources or whatever the case is, they would put it into a category of challenge. So this would be your normal situation where you pick up heavy things and then you get stronger because your body is like, okay, this thing is heavy, but we're doing it often enough to make it a part of our daily life.
Yeah.
So the smartest thing to do would be to adapt to this thing and to get stronger to make this motion more economical and resource efficient. And for the most part, that's what happened.
Yeah.
But the second scenario, if it didn't move into the challenge category, it would move into a threat category. And a threat category would be categorized as a stimulus that your body's like, either don't have the resources to adapt to, or it's too great of an adaptation, it's not efficient, or whatever the case is. So through that, your body, instead of adapting, will start to adopt an avoidance strategy. So it would actually get weaker, or it would try to make it so that doing the actual thing that you're trying to adapt to, impossible or harder. So you would avoid it altogether instead of trying to adapt to it. So this would explain the reason why certain clients got better and other clients just even got weaker to a certain degree. So this kind of opened the door for me because at the time it was just biomechanics. I had no idea anything about neuro or brain or how brain connects to the body at all or anything. It was just muscle, bones, that's it. And so this kind of opened a world to me where I was just kind of like, okay, well, this entire umbrella, this entire category of how the body functioned, not only was I not aware of, but I was working in tandem, but just completely random with. So that didn't give me a very good sure footing or anything like that. So I definitely wanted to learn more about neurology. And at the time, I was kind of like at a crossroads where I was just like, well, I could go through a bunch of certifications and seminars and be a personal trainer with a neuro understanding, or I could just go to chiropractic school and get a doctorate in neurology. So at the end of the day, I just decided to go through chiropractic school. And so even moving into chiropractic school, I had a very neuro perspective, neuro-based, brain-based type of care background approach to it. So that's how I became a chiropractor.
Okay. Did you like have any experience with chiropractic before when you were a PT or even before you got into neurology?
Yes, actually. So, but it was very, like the timeline was very crunched in.
Okay.
Because it was while I was a personal trainer, and my original reason for going to a chiropractor was actually not like neck pain, back pain, the normal stuff.
Yeah.
The chiropractor that I first went to actually was part of the gym that I trained at.
Okay.
And at the time, I was deadlifting, and I was trying to hit a PR,
Yeah.
but my grip strength on my right hand would give out, and I'm right-handed.
Right.
So I was just like, this makes no sense. So I had to like start taking out warm-up sets just to have more grip strength to hit my actual working sets. And I was perplexed because I was like, okay, this is weird, you know.
Right.
I'm falling into that category where the more I lift, the weaker I get, kind of thing. So I asked my chiropractor about it, and she was at the time she was like, oh, it might be an elbow issue.
Okay.
And right there, I was like, look, lady, I just said it was a grip strength issue.
Yeah.
Nothing to do with elbows, obviously, but whatever. You know, let's go along with it. So my first session, she did a bunch of muscle tests and adjusted my elbow and did the muscle test and instantly saw strength come back. So at that time, I was like, okay, that's a neat trick. Didn't know what it meant, but whatever. She was just like, all right, go and try to lift. So I'm like, sure. Let's humor this. I don't really see how this is all connected, but whatever. That next day, I think I pulled my PR. So I was just like, nope. I went right back to my chiropractor's office. I was like, what is this witchcraft and wizardry that you did on me? And basically she just explained to me very easily where if the elbow is misaligned and the thing that's causing the elbow to undergo excess stress is you picking up extra heavy weight, the body's going to try to protect the elbow by shutting off the main stressor. So when you realign the elbow, basically there's no need for this protective mechanism to happen. So it gives you back your grip strength, and therefore you're stronger. But you're not really stronger. You're right back
that function.
Exactly.
Is that like along the ideas of nerve interference, as some people might know it as?
It's less about nerve interference and more about your body's innate ability to protect itself.
Okay.
It's very intelligent in the sense where it's just kind of like, okay, well, if grabbing this whatever heavy deadlift it was is compromising the elbow joint because the elbow joint's not tracking properly, then in order to protect that, we just have to get rid of that stimulus.
Okay.
And if you can't hold on to it, then we've effectively gotten rid of that stimulus.
Gotcha. Okay. So as a chiropractor, is there like a specific way that you treat patients or you assess patients when they come in?
Yeah. So I specialize in a technique called applied kinesiology.
Okay.
And at face value, it looks like a bunch of muscle tests. When you dive a little bit deeper, it's more of a neuro assessment, essentially. The way I like to describe applied kinesiology is it's a very strong diagnostic tool. And basically at a deeper level, you're actually using the nervous system as almost like a biofeedback system. And you're able to use the nervous system in a sense where you can provide stimulus and you can ask the nervous system literally like, hey, does this stimulus fall in the challenge bucket where you can adapt to it, make it better, or does it fall into a threat bucket where you're trying to implement avoidance behavior, essentially. So through this, we can actually test to see whether the neuro is responding properly, whether the soft tissue behavior is correct, or if it's trying to avoid something, or whatever the case is. And more importantly, we can figure out, hey, if there is aberrant behavior in the soft tissue, how we can restore its normal function by basically communicating properly with the brain.
Okay, sweet. Now, are there like a specific population of patients that you treat that you find like, hey, this is like really effective, or they're more appreciative of, okay, like this is really helping me with my goals?
Absolutely. So, I mean, dysfunction is kind of like rampant throughout everybody because we are constantly fighting the forces of gravity in general.
Okay.
So this type of treatment, it's just like as long as you have dysfunction in the body and stuff like that, we can help clean it up regardless. But I do find that a lot of MMA fighters, combative sport practitioners and stuff like that do find me through that way, just because it's the goal of the sport is to hurt each other.
It's a lot of stress intentionally put on your body.
Exactly. So a lot of times when misalignments are done, you're overpowering an opponent. Like for example, like when you're grappling. A lot of times when you watch it from the outside, it really just looks like a brute force battle of like just head to head, two rams going at it type of thing.
Right.
But when you get into the intricacies of it, it's all about leverage and maximizing leverage and power levers and all this kind of stuff, to the point where I don't care how strong you are. It's just like, you have a lever and you can move the world, right?
Right.
So that's the idea. And a lot of times when I work with grapplers, they blow out receptors, they have misalignments all over the place. And it's not that they're weak or they're unconditioned. It's just because their body is seeing like, hey, that joint is unstable due to this leverage power arm that's being placed upon it. So we're going to actually inhibit the muscle to protect yourself. But, it does its job in protecting the body, but in exchange you lose at the sport. And, so basically, combative fighters and stuff like that, they're pushing all the way to their very last breath, just like any other athlete and everything. So it's very, dysfunctions are very rampant in that sport, basically. So I find a lot of combative fighters and stuff like that benefit from this type of care.
So would you say, like, let's say, for example, some of the stuff you talked about, trying to hit a PR, maybe like grappler that's like holding off to the very last minute, like where they're being choked or their limb is being exposed to something, does that cause lasting effects on the body that like, hey, this was a danger or a threat level and like we want to avoid that? Does your body say that and that's what they come to you with, like, hey, I feel weaker because my arm was being bent in a certain way and now it's like I can't lift as much as I could?
Absolutely, 100%. Actually, probably you probably put it in like the perfect scenario right there. Pretty much, it's just kind of like anytime you push your body to a certain point, going back to that stress bucket. Obviously, when you lift weights and stuff like that, you can periodize it just fine to the point where every time you lift is a perfect amount of weight where your body and your nervous system views it as a challenge, so you get stronger each time. But when you're doing any sport, not just combatives, when you introduce that concept of competitive sport and you're trying to win, you're going to push past that limit more often than not. And when you're in that limit, there's more of an equal split when it comes to stimulus. So there are stimuluses in which you can adapt to, and there's plenty of stimuluses that your body learns to have an avoidance to. And that doesn't always come in the shape of an injury. That can come into, that can look like preferences. For example, like, if we're playing basketball or something like that, and I'm stronger or I'm more activated, coordinated, or whatever the case is, driving on the right, then my preference is going to be on the right. Can I go to the left? Yeah, but for the most part, I'm going to be less coordinated, less flexible, speed is not there, strength is not quite there, and everything like that. So the nervous system has seen that this is a less stable mode of movement. So it's going to give us certain things to kind of persuade us out of that line. Now, if we continue to press that line, like let's say, they've gotten my right side line dialed, and I need to, they're gonna shut me down every single time. I have to go to the left. Then that's when I'm going into less practice territory, places where I'm unstable, injury chances kind of go up a little bit more, and you can easily push yourself into like that threat category of the bucket. And but yeah, definitely, that happens all the time when it comes to athletes, when it comes to people who are just working out or making a new PR or getting gains to new areas. A lot can go wrong there. And that's where I definitely can come in and kind of tweak things and help urge that process along. When they do get to that point, though, there is obviously the structural aspect where it's just like, you go for an arm bar, you go too far, you break the arm. It's a structural given, right? So There is that, but there's also a huge gray area where before the arm breaks, before there's any structural damage, there's a bunch of receptors, basically, and they kind of get freaked out. And your brain ends up putting kind of like injury software on the area. So it's like you don't actually have structural damage, but you have software programs that are protecting an area due to how close you got to structural damage. And that usually doesn't go away unless you actually treat it.
I see. Okay. Now let's talk about when you're treating patients. Do you have a specific philosophy that you approach when you're getting a patient that walks in, helping them get better?
Absolutely. So first and foremost, like some patients come in thinking there's like a doctor-patient relationship between me and them. And you know, at face value, there is, but I actually don't really like that approach for the most part. And the reason being is because they kind of come in with this perspective where it's just like, oh, okay, you study this, you know everything, you're going to tell me what's wrong with me and I'm going to listen kind of thing. And to a certain degree, there are things that I can enlighten them about. But at the end of the day, we're working with the nervous system. And the nervous system is as varied as fingerprints and snowflakes, pretty much, right? And at the end of the day, their nervous system, they've grown up, they've been born with their nervous system from day one. So to walk in and be like, hey, I know your nervous system better than you do, is, you know, arrogant at best. So I always like to kind of frame it a little bit differently. I like to frame it instead of a doctor-patient relationship, we're actually a pit crew to the patient, basically. It's just, hey, you're a patient, your nervous system is in this race car, which we call your body, and you're in this race we call life, and you're going to have your dings, and you're going to have your oil changes, you're going to have your misalignment wheels and stuff like that, and you come in here to get checked, pretty much. But basically, at the end of the day, I'm a diagnostic program, and I'm going to help you out with whatever we find. So if you're taking a right corner or a left corner or whatever the case is, and you're like, hey, I feel this little hitch, that kind of gives me clues. We start digging, we start looking, we start asking and consulting with the nervous system. And when the nervous system kind of gives us our answers where it's like, hey, there's deficiencies here, there's weaknesses here, then that's where we can start to work. We can start clearing it, and we can start asking the nervous system, like, hey, what do you need from us? What kind of resources do you need from us in order for you to return function back to us? What I mean by function is strength, coordination, speed, range of motion, but more importantly, even absence of pain too. Because we don't really want to focus on pain too much, but at the end of the day, pain is one of the strongest motivators in our society for the most part. And pain isn't always injury, and injury doesn't always equal pain. But I like to kind of share that pain is more of a deterrent signal. So now obviously if someone comes in with a broken arm, I'll be like, you're going to the ER. There's no amount of neuro that we can do that's going to make that go away. But at the end of the day, it's like if there's no injury but there's pain, there's avoidant behavior, we can start to dissect that and see why there's avoidant behavior. And then we can get rid of that software, get rid of the pain.
Okay. Let's switch gears a little bit here and talk about, because I'm still a chiropractic student. Now, let's talk about the transition from school to being in practice. Are there stuff that's kind of carried over or stuff that you've done outside of school that made you better as a practitioner?
Absolutely. So I want to say I probably use about 10% of what I've learned at school. And the other 90% we've either learned from experience and practice or outside seminars. And from just being in practice for this short amount of time, school is, their main job is not to make you a good doctor. It's to get you to pass your boards, and that's it. So being a good doctor, finding your practice style or how you want to practice and how you want to treat patients and everything, that's all on you. And that's definitely, that's my biggest piece of advice for students is go through school, go through everything that you need to do, but always take your education and your future plans and goals and stuff like that into your own responsibility, because that is your own responsibility. So that's the way I'd like to kind of phrase it first and foremost. That being said, learn as much as you can. you don't know what you don't know. So even if it's not quite like piquing your interest in this moment, try it. Explore. Just keep asking questions, keep learning. And we put a lot of stock in making sure we learn or know or get to the things that we want to do.
Okay.
But in the grand scheme of things, it's just one more data point, one more data plot on this grand ocean or this stream of things that we know.
Yeah.
That being the case, knowing what we don't want to do is just as important as knowing what we do want to do, and what we're good at, what we're not good at, and what we want to include, what's realistic, all this kind of stuff. Because let's say there's 20 different techniques that I'm super passionate about, I really love, I want to do all of them.
Yeah.
But in the grand scheme of things, we only have 24 hours a day, we only have 7 days in a week.
Right.
You got to balance out how much time you want to spend with the patient versus how many people you want to affect, and all this kind of stuff, and how many of those modalities can you implement into your practice style.
Right.
And going into it, chiropractic school is also not cheap, and it's definitely getting more expensive. Student loans are coming up, so to share a little bit of the realism and everything, that's something that students also should be thinking about when they go into practice or choosing how they want to practice and stuff. Is at the end of the day, you can work for other people too, but if you open your own business, you have to know the business side of things. You have to be able to balance your checkbook. You have to make sure your overhead is taken care of. You have to make sure savings are there, and student loans aren't piling up, or whatever the case is. So these are just small bits of reality that school definitely doesn't prepare you for at all. And the worst thing to get is blindsided, especially by some of these things.
Right.
When you're all tired and burnt out from school.
Yeah, that's true. Do you feel like students that are maybe like getting ready to graduate and get practice, like it's a good idea to maybe have some sort of mentorship in the business aspect of things and how to run a practice? Maybe that's why people go into associates, but like it's a good idea too. Hey, I should probably know a little bit about running a practice before I actually like try to run a practice.
Absolutely.
Yeah.
It's to each their own. And I went into practice immediately after I graduated, but that's because as a personal trainer, I was part of a very small private gym.
Yeah.
It was just me and my boss, and my boss had all the overhead. I kind of studied how he ran things and how he went about doing marketing. And even before then, I was in the internet marketing business kind of field.
Yeah.
So I kind of had a little bit of experience dabbling in that field. So I felt like I had a good enough perspective to kind of start off on my own. That being said, mentors are always very good. It's nice to have someone on the outside looking in, and a dedicated person is always very beneficial. However, they can also be very expensive too.
Yeah.
So, there's a lot of business lessons that can't really be taught; they have to be learned. I know that's kind of a strange concept, but you just really have to go through it yourself. It's kind of like the adjustment. It's just kind of like, you can't explain to someone who hasn't had an adjustment how it feels. You just got to try it, and then it all makes sense, kind of thing at that point. So it's kind of one of those trial by fires kind of situations. By all means, prep as much as you can, have as much support, but at the end of the day, you got to do it yourself. You got to experience it and just try it.
Good. Now to cap it off, we usually ask this question: what is chiropractic to you?
Chiropractic to me, I think it's more profound as a philosophy, more than a technique or category or even job or career title, I guess you could say. And the idea for chiropractic for me, it always comes back to brain, neuro, all that kind of stuff. So if the brain and the brainstem connected to every single cell in the entire body, basically, if there's any interference in between the brain and where it's trying to go, you're going to have lowered or deficit functions in the endpoint, basically. So chiropractic by itself, if that interference happens in the spine, then everything downstream of that will start to have lower function. So by correcting that segment or relieving pressure off that nerve, then you'll have increased function and everything downstream. That's the thought process behind it. Whether that's hard bone on soft nerve or misalignment causes inflammation, inflammation being liquids squeezing on the nerve, whatever the case is. But the idea is it's like this trickle-down theory for me. For me, I've melded chiropractic philosophy with my concept of applied kinesiology. The way I like to think of it is if there is a house with circuit breakers, light bulbs, and the light filling the room, the circuit breakers will be akin to the spine, the light bulbs will be akin to the muscles, and the light going into the room will be your function. So this will be strength, coordination, normal movement, all that kind of stuff. So if you have aberrant movement or there's a light bulb that's not working in a room, then we don't really know whether it's a light bulb issue or a circuit breaker issue. So I would usually start with the circuit breaker or the spine. And flip all the circuit breakers, adjust the spine, make sure everything's good, take another walkthrough through the house. If that light bulb is not working, then we know it's a circuit breaker issue. But let's say that light bulb is still not working. Then we can know, or we know that would be a light bulb issue through the process of elimination. So that's basically generally how I break it down to most patients, where it's like a chronological approach to viewing whatever their case is. And going back to that pit crew conversation, when you see someone coming in limping, you have your first thoughts. You have like, okay, well, most people limp because of this condition, but until you do thorough testing, until you actually get your hands on and like feel what's going on, you have no idea. So I always like to give that approach to our patients, so that way they see that there's a chronological system in which we're kind of screening their whole body, their whole nervous system, their structure, all that kind of stuff. It's just to make sure we get to the bottom of what's going on.
Got it. Well, I appreciate for taking the time and letting me come in here.
Of course, it's a pleasure, man.